This week at the Rangiora Vet Centre, Marcella demonstrates a senior health check with a little help from Vinnie the cat.
So this is Vinnie. Vinnie is a 10-year-old cat, so he's classified as a senior cat. Any cat over the age of about 8 is considered falling into the senior category and needs a little bit of extra care. So at the vets, with every cat, no matter what their age, we should see them every year for their general annual health check. But when they get to be about 8 and older, we like to do a little bit of extra with them just to prevent or try to slow the progression of some of the most common diseases we see with geriatric cats. A lot of complaints we hear from owners about their cats is that they're drinking lots of water, they seem to be losing weight in the face of a really good appetite, they seem to be slowing down and grumpy and you know, not as active as they used to be. So what we do for a senior animal health check is we do a full exam on them. So for an older cat, we focus, you know, from head to toe. We start with their teeth and look there. A lot of times older cats get dental disease that needs to be addressed, and we can do that here. And what we also check is the thyroid gland, which is a little gland that sits around the bottom of the neck, right on top of the trachea. And quite commonly older cats get a disease called hyperthyroidism, which is a treatable disease and at times curable if your cat is a good candidate. So in addition to the physical exam, we also will probably recommend that we run a little bit of blood work on a senior cat. And the value of that is that we can check for kidney function, we can check for liver function, look at glucose levels, and also at the same time assess urine. And the value of looking at urine is we can pick up kidney disease through the concentration of the urine. We can see, is there any glucose in the urine? Are there any white blood cells or red blood cells? Any bacteria indicative of a urinary tract infection? And all those things can be, you know, they can take quite a toll on an older cat. So we like to treat them before they become a problem. So then what we do is we move on to the tummy, and we have a feel inside, and we feel for any lumps or bumps in the, you know, in the stomach area. Feel what the liver feels like. Feel the kidneys, of most importance in older cats. Kidney disease is very common. Quite commonly in older cats, you'll notice they get their nails caught on things because the muscles that retract the claws become quite weak. Something we commonly see in cats with hyperthyroid disease, but it can happen for any reason. So what I'm going to do is just trim his nails. He's not a fan, but that's all right. And we're just trim the tips off so the sharp bits are gone, and then that prevents him from getting it caught. So another important aspect of the senior wellness exam on cats is to look at their eyes, looking for signs of ulcerations or anything going on at the back of the eye. So we have a look at the back and look and see if there's any abnormalities that we need to address. The most common conditions we see in geriatric cats are kidney disease, hyperthyroidism, and diabetes, and they all can have somewhat similar clinical signs to the untrained eye. So it is very much worth running the blood work at a fairly nominal cost.
Join us next week when Rebecca takes us through mobility problems in cats.